Well, Beverly, I have been going there in the last 1 week, knowing that if the virus spreads, it is certainly going to impact these slums, which are basically there are about 1 million people living in close proximity, as you just pointed out, and it's people are miserable there because it's obscene even talking to them about social distancing. I mean, how do you talk social distancing to people who live like about 7 people in a small little shanty and with no sanitation, with no water, and with no soap and with no hygiene? I mean, it's impossible to talk to them about social distancing because that seems sort of a privilege. So we have so far reported our first death in Dharavi, which is Asia's largest slum, which means that there could be many more infected cases. In another slum close by, they have quarantined about 80 people who the authorities suspect already are corona positive. So the situation is really miserable, especially in the slums in India. And there is a clear structural divide between the privileged in the country and the underprivileged, especially in the rural areas. So India, at this point of time, is in the early stages. We are 2 weeks away from the United States and perhaps 4 weeks away from Italy, but the numbers are surging really at a very rapid speed.
So to that point, Rana, how prepared is the country for the medical emergency that will emerge?
Well, India is trying to do its best. Indian agencies, Indian government have announced a 21-day lockdown. Was India prepared? I think India could have done much better because, uh, in January, in China, when China reported some of the maximum number of cases, India was still fighting a majoritarian fight where it was in the headlines for the anti-Muslim cases and the anti-Muslim carnage. So we are still far behind. Our hospitals are not prepared. Given the surge in cases, we do not have enough ventilators. Our doctors and our health workers do not have enough protective gear. But the government has now started taking initiatives. We have built the first hospital just for corona patients, which will have 1,200 beds just for patients who need to be quarantined in the hospital. But we are still a long way ahead from protecting the country because the way things are right now, Mumbai, especially the financial capital of the country, could be the hotbed for corona positive cases, and we are still lagging far behind.
Many countries are moving to provide some form of support to the most vulnerable. Has India done that?
Well, India is trying to do that, but it's still far behind. I mean, last week we saw images and visuals all over our television channels where migrant laborers and daily wage workers were traveling all the way from the cities to the villages to their respective hometowns. What we have to understand is a big population of India lives in the rural areas where we still are not sure about the penetration of the virus. Yes, we have enough food, but the biggest concern for India is not how many would die of the virus, but hunger deaths. Because now that the lockdown has been announced, it will be difficult to supply food and other relief material to the villages, where the communication and transportation is extremely difficult given the lockdown. It is at the end of the day, it is still the poor in the country who are suffering the most, the daily wage workers, who are really miserable, who basically just have enough to eat one meal a day, and they do not know how they're going to survive the next day. So at this point of time, the biggest concern for India is the 50% of rural India, which will be in a devastating state in the weeks to come.
And of course, India has experienced quite an economic boom in recent years. The more privileged in society, are they abiding by the rules and going into lockdown?
I'm sorry, Beverley, I missed the question.
I'm saying, of course, there are many privileged, as you point out, people. We've seen lots of examples where people of privilege are not abiding by the rules, not going into the lockdown, not taking the virus seriously.
Well, Absolutely. Well, so we had images of a large numbers of migrant laborers and workers out there in public at the bus stations and at the train stations in thousands. But to expect social distancing, which the government is asking them, is a bit of a privilege, because the privileged are out in their balconies, they have stocked their refrigerators, they have sanitizers, but the poor in this country cannot afford social distancing or a lockdown, because here they are, 20 people lost their lives in the last 2 days while they were migrating from the urban areas to the rural areas, walking thousands of kilometers. So they do not have the privilege of being locked down. So the government has guidelines, but the guidelines can only be imposed on people who at least have 3 meals in a day, or have the essential commodities. The privileged are observing that. The privileged are deep sitting inside their respective homes, but again, they have everything stocked up. The poor cannot do that, which is why we see them out on the streets, and which is why we fear that it's difficult to contain the virus in a country like India, where the poor are out on the streets yet, in a very, very mismanaged state of affairs by the Indian government.
Good to talk, Rana. Thank you for your time.
Thank you, Kimberly.